there are red flag warnings that we're always looking for and that you guys should look for in yourself. If you start to get burnt out, if you start to suffer from depression, from anxiety, you name it, we watch for things like cynicism, not showing up, not doing things that you used to do, not being engaged. Those are all the red flag warning signs that within your residencies we're looking for, but they're things that you might notice in your friends. If you're thinking about looking at yourself, don't try and self-diagnose. Don't write yourself a little prescription for Prozac. It's not the right thing to do. You should actually go and get some help if you feel like you're having a problem, or go and talk to somebody who can do a more objective assessment. If we ever worry that there's something bad going on, either chemical dependency, mental illness, sleep deprivation, or just something horrible going on in your life, we will pull you from active duty. And that can be your husband slipped the divorce note in your lunchbox, which has actually happened in our residency. She got onto the SICU and opened up her lunch and was getting divorced and didn't know it. There are horrible things that can happen during your residency, and maybe they're not that bad, but if there's something acute going on, we're going to intervene and pull you from duty if we think we need to. Don't be offended if we ask if you're having problems. We're not judging. And we'd rather look into it and say, okay, it's not an issue, or get you to the right resources, than look back and say, wait a minute, what happened? And we did have a suicide in the emergency medicine residency very early on, and it's something where we don't ever want that to happen to anybody, anywhere again.